Alright, now I'll be reviewing assignment number 5, the respiratory worksheet quiz. The most prevalent underlying pathophysiologic mechanism associated with asthma in children would be bronchial inflammation. Lenny, a 10-year-old male who's being seen in the primary care office for cough and wheezing associated with cold symptoms that began 2 days ago. He has a history of asthma, but is usually well controlled with the use of an albuterol inhaler once a week. Typically, he's not bothered at night by his symptoms, and he participates in sports without missed games or practices. How would his usual asthma symptoms be classified? Intermittent is the correct answer there. And really the defining factors would be the frequency of his albuterol use, whether or not he has symptoms that bother him or awaken him at night, and his ability to participate in routine physical activities without missing games or practices. That's how you look at that for the severity. Alright, so Lenny, he's still 10, he's still a male, and he's in the clinic because he's having worsening of his asthma symptoms. At this time, his symptoms are occurring daily. He needs to use his albuterol inhaler 3 times a day. He has chest tightness and wheezing, and that's kept him home from several soccer practices. According to the asthma guidelines, what medications would be most appropriately recommended next for his management? So the correct answer is a medium-dose inhaled corticosteroid such as fluticasone in combination with a long-acting beta agonist, salmeterol. So again, you just need to look at your stepwise approach for the appropriate age range to derive that answer. All right. Leota is a 14-year-old middle school student who's experienced some weight gain recently. Has started a new exercise program. She complains of shortness of breath and wheezing when she runs. In the past, she's experienced chest tightness and wheezing with respiratory infections. You order spirometry testing and find that the FEV1 is greater than 80% with a 20% improvement after the use of a short-acting beta agonist. Her FEV1/FBC is 85%. Based on the pulmonary function findings, how would you most accurately diagnose Leota? Mild persistent asthma was the correct answer. And the key there is the fact that she has a 20% improvement after the use of a short-acting beta agonist. The 20% is what is significant there, because if we're getting that much of an improvement, then her underlying inflammation is perhaps a bit more profound than what she can truly appreciate. Even though she only feels symptomatic with exercise, the fact that you can induce a 20% improvement with use of a short-acting beta agonist is what's significant about that information. When determining if a treatment should be intensified for a patient with worsening asthma, which of the following factors should be assessed? Medication administration technique, adherence to the asthma treatment plan, environmental control, A and B, or A, B, and C. Everyone got that right. It is all of those things are important when trying to figure out do we need to move along the steps and increase our stepwise approach, or do we need to revisit some of the teaching in regards to these particular items? Select all the following medications used as controllers for chronic asthma management in patients 4 years of age and greater. So, this was a tricky question, as you see the wide distribution here. There's more than one answer, and the key is a controller for chronic asthma. So the correct answers are inhaled corticosteroids, long-acting bronchodilators, and the leukotriene receptor agonists. The short-acting bronchodilator is not considered correct because that's not a control medication. That is a short-term or as-needed medication. That's not considered a controller technically. So really this question was confusing just because of the wording. I don't think you'll necessarily encounter something like this on boards. And I won't have this question on the final just because of how confusing that was for everyone. So there's your answer to that one there. A 9-year-old child presents with an exacerbation of her asthma. She's somewhat agitated and speaks mostly in phrases due to her wheezing. She has a history of using a peak flow meter, and when tested now, her peak expiratory flow is 55% of her personal best. How would you classify the severity of her symptoms? The correct answer is moderate. She hasn't quite hit that severe yet. If we don't intervene, I imagine she would get there potentially. But technically at 55%, that's considered moderate. The mother of an 11-year-old accompanies him to the office and reports that the patient is having chest tightness and wheezing. He's more comfortable sitting up, speaks in phrases, and is not using accessory muscles for breathing. He has a history of frequent asthma exacerbations and uses a peak flow meter to monitor his status. His readings now are 55% of his personal best. He has increased the frequency of his albuterol meter dose inhaler to 2 puffs every 4 hours, and he continues to use his ICS LABA inhaler as directed for regular care. But he's not getting relief. What will be the priority treatment at this time? So the priority treatment, meaning what are we going to do in the immediate term as he is having an exacerbation and is symptomatic here in the office? So the correct answer is starting an oral corticosteroid, and that would be a short-term burst. When looking at the future, that's when you might want to, you're not going to refer to the ER because of impending respiratory failure. There's no indication of that because at 55% of his personal best, he's really in that moderate stage, not severe. You're not going to have him increase his ICS to the highest potency and continue his albuterol every 4 hours because that is not that's not for acute symptoms. We're not at the point where we're going to add theophylline to the current treatment plan, and it is very acceptable to start a short burst of oral corticosteroids for these exacerbations that happen. All right, when instructing a 12-year-old newly diagnosed with asthma how to use a peak flow meter, you're going to tell them to do all but which of the following. Inhale as hard as possible to move the indicator arrow is the correct answer there. And it's not inhaling. We want them to exhale as hard as possible. So we're not going to tell them to inhale. So again, you just have to kind of read what the question is asking you, just because there are phrases like that on boards. So as much as you need to memorize and understand knowledge content, you also have to have your testing strategies handy in your mind. Jolene is a 44-year-old production worker who's been experiencing worsening of her asthma since she became divorced, moved back to Kansas, and took a position in a manufacturing company. She has recently started smoking again. When considering triggers for asthma based on this history, which of the following are most likely present? And select all that apply. Do you think it's a viral infection? I wouldn't think so necessarily. Mold and pollen? Yes. If you are at all familiar with Kansas at any point in time, it's absolutely mold and pollen. Stress? Well, it sure sounds stressful that she's divorcing and moving from a different state and taking a new position. And then, of course, we know tobacco is obviously a known trigger. So the answers are everything but the viral infection. She has no indications of a viral infection at this point in time. Again, the worsening of her asthma symptoms since she became divorced, moved to Kansas, and took a position in a manufacturing company and started smoking. So no fever, no constitutional symptoms. So really, you just have to kind of look at what they're asking you. All right. Hopefully that was helpful for everyone.